As the third wave of the pandemic ravages through South Africa with more than 11,000 infections reported in the last 24 hours, health authorities have raised concern over the mutation of the Delta strain, which is a variant initially identified in India. The variant is known to be extremely transmissible and dangerous. For more on this, we're joined by the principal medical scientist at the National Institute for Communicable Diseases, Dr. Janelle Beeman. Good evening, Dr. Beeman. Thank you so much for your time tonight. Firstly, what do we know about this Delta Plus variant?
Good evening, and thank you for having me on the show. So a lot of the information that we currently have is from data generated in the UK. So we know, for example, that it is more transmissible than the Alpha variant, which is what was predominating previously in the UK. We also know that it does have some immune escape mutations that are similar to what's seen in the Beta variant, which is circulating in South Africa at the moment. The one kind of positive news that's very preliminary is that it may not be as different from the Beta variant in terms of its sensitivity to antibodies, and so the vaccines that were being used would have probably the same kind of effect as they would have against the Beta variant.
Has there been an opportunity to actually fully analyze the difference between, perhaps I imagine many South Africans would be concerned about the variant that has been mostly transmitted in South Africa versus what they've picked up now?
Yes, so there has been some preliminary investigations looking into that, and I think overall they are very similar. There's probably one region of difference between the two that might impact in terms of antibody responses, but overall I think the South African, or the Beta variant, should I say, has many more mutations than the Delta variant.
At this point, do we know where in the world it has been picked up outside of India?
Yes, many countries actually.
Okay.
Yeah, it's been transmitted quite widely. Currently, very many countries.
Okay.
I think over 80 different countries so far.
So
Yeah.
I mean, is there a likelihood that it's already in South Africa?
It has been detected. We have detected it in South Africa. We did release some statements from the NGSSA, which is the consortium within South Africa that is looking at these and monitoring what variants are in South Africa. So it has been detected previously, and yeah, we've seen it in South Africa already.
Should we be worried about that?
You know, overall, I think, irrespective of which variant we currently have circulating in the country, the measures that we as a public can implement ourselves in terms of wearing masks and social distancing, those are all going to be the same. So, you know, while there is concern about how these different variants might affect vaccines, whether they're more transmissible or not, the bottom line is if we all, especially right now, given the situation, practice wearing our masks and trying to stay at home as much as possible, only going out for essential activities, you know, no matter what variant it is, those things are going to help in terms of slowing down transmission.
How closely are you as scientists monitoring the different variants that we have circulating amongst our population, and does it matter, you know, information such as the B variant being the one that is predominantly in the country versus perhaps even the Delta Plus, which you say you've picked up previously?
So we are trying our very best to monitor in as close to real time as possible. Of course, there are challenges, especially when it comes to our waves and peak periods in terms of getting samples to the sequencing labs. But we are trying very hard. We are hoping to have some more data, more recent data released early next week, which hopefully, especially in terms of Gauteng, will shed some more light on exactly, you know, which variants are circulating and at what frequencies. But like I said, overall, while we keep monitoring, we keep checking, the reason we do that is, to investigate what impact any potential new viral evolution mutations might have on the therapies and on the prevention methods that we're currently using. And the ones that have been identified thus far, we kind of have a good handle on them. And we know that, wearing your mask is still going to prevent that from spreading or limit it from spreading. And social distancing and sanitizing, those practices are all things within our control, which will limit the spread. And then, as I mentioned, in terms of the vaccine efficacy, we obviously don't have that data, but we do know that it has similar mutations to what we've seen in the beta variant.
For people who would have perhaps previously contracted COVID-19 and there is some kind of immunity that one would expect that they have built, is there a likelihood that they could well get reinfected with a Delta Plus variant?
We're not really 100% sure in terms of that. We don't have very much data, but based on the mutational profile, depending on when they got infected previously, they might have a good enough antibody response to prevent infection from the Delta variant. But of course, as you know, your antibodies don't last at a high level forever. They do decrease and wane with time. So obviously, if they've been potentially infected last year in December in wave 2, it's very possible that their antibody response may have waned to this point and they would be able to potentially be reinfected. But like I say, we don't have a lot of hard evidence around this.
Dr. Beeman, that is certainly not good news at all. We'll keep an eye out for some of the work and the research that you're still doing when it comes to the sequencing of the various variants of COVID-19 that are currently circulating within the South African population. Dr. Janelle Beeman is the principal medical scientist at the National Institute for Communicable Diseases.